We also have our own Doctors Council benefits. We emailed out to all of you a link to the full summary plan description, the SPD, as well as attaching a 4-page highlight booklet. Please know that these are exactly the type of benefits that employers tend to try to erode so that they increase their own profits. This shows the importance of belonging to and being a member of a Doctors Council union and having a contract that guarantees and protects your benefits and jobs. As part of the Doctors Council Welfare Fund benefits negotiated in the contract by our union with your employer, you are a participant in the Doctors Council Welfare Fund. As an eligible participant, your employer makes contributions to the fund. Provided that you continue to meet the eligibility requirements, contributions will continue at no cost to you because of our contract. I hope you find tonight's presentation informative and useful. Thank you again. Dan.
Thanks,
Kevin.
Dr. Kosha. So doctors, before I turn it over to Dan Donlan, who administers our welfare fund, thank you not only for taking the time to call in tonight, but for those of you who submitted questions in advance. What we're going to do now is Dan's going to go through the booklet that highlights the benefits, the more popular benefits, then answer some of the questions that came forward, and then go through the summary plan description document and touch upon any benefit that wasn't already touched upon either in the booklet or in the question. I'm going to put everybody on mute in a second. If you have any further questions that you would like to have addressed, please send them to me in the chat. And if time permits, in the back end, we will answer them. Please put your name in the question as well, because in case time doesn't permit, then we'll circle back to you and answer your question tomorrow or the next couple of days on a phone call. Fair enough? So without further ado, number one, I'm going to mute all. Then we're going to attempt to share screen. And can everybody see that? All right. Well, is it on your? No. Share.
Not yet.
Okay. Okay. Mr. Dan Donlan. All right. Good.
It's cold out. Okay. Good evening, everyone. Thank you again, and we appreciate all the work that you doctors have been doing. And I hope again that everyone is keeping well and safe. So what we'd like to do is first go over the this benefit booklet that many of you have already seen and should have received by now. And just to re-emphasize that these are benefits that are provided to you and your eligible members of your family at no cost to you. So it is important that you recognize that, because it is it's very substantial in many cases. So one of the first benefits, it's probably the most visible one, it would be the healthcare cost reimbursement benefit. So that, I say it's most visible because that's where it's $1,000 that you get in reimbursement for out-of-pocket expenses that you would probably spend very often and not pay much attention to, such as your health insurance premiums that you pay, that's deducted from your paycheck. Right off the bat, that's usually a nice piece of change. And that it's simple to do. You just make a copy of your paycheck, which shows those deductions, and attach it to the healthcare cost reimbursement claim form and submit it to get reimbursed. So in addition to that, you have out-of-pocket prescription drug co-pays or prescription drugs, any out-of-pocket medical expense that's not covered through your medical insurance or the welfare fund, such as dental, where if you go to a non-participating provider and you have to pay out of pocket for some of those procedures, you would be able to get reimbursed for those out-of-pocket expenses just by submitting an explanation of benefits for that dental claim, and again, attaching it to the claim form. And then you get reimbursed for a maximum of $1,000 per family. It's not per individual, it's per family. So that's important to recognize as well. So moving on, talking about the dental benefits, there again, that's a pretty good example of how you can save a lot of money by going to a participating provider. Of course, you're not obligated to do it, but if you should go to a PPO, there's no cost to you for any of the services that are covered under the plan, and most of them are. There again, you would present your a claim form, which is I recommend if you're going initially to a dentist for the first time, and so the dentist becomes familiar with our plan. And I know we get this question a lot, is when, well, I told the dentist my plan is Doctors Council Welfare Fund, and they don't recognize Welfare Fund. So I always recommend that the member either use our dental claim form, which has the name of the firm or third-party administrator, which actually processes these claims. Is administrative services only a self-insured dental service, and many providers will recognize that because they administer a lot of other plans. So if you go to a participating provider, as I said, the maximum allowed for a family is $13,000 a year and $6,500 per individual, which is pretty rich, and very rarely does anyone reach that. And if you go out of network, then you would pay the provider and then submit a claim form to get reimbursed based on the fee schedule. And just two things to point out, both the dental benefit and the healthcare cost reimbursement benefit are administered through administrative services only. So those claims should be submitted directly to administrative services, and their address, website, and phone number is listed on those claim forms. So if you send it here, it's just going to delay the processing of those claims. And as now, it also is possible for you to upload those claims to the website of Administrative Services Only after you create an account. So you can actually avoid mailing it or faxing it to the office here and just upload it through their website, which is asonet.com. The hearing aid benefit. A lot of plans, I should say not a lot, but some plans do not cover hearing aids. So our plan does. The maximum allowable amount is for a purchase or repair of a hearing aid is $1,500 per ear every 2 years. And years ago, just to show how the benefit, the members have an impact on how the benefits can be expanded, it was requested that it be expanded to dependent children, and having our consultants review and with the trustees, it was determined that yes, we could do that. So that's an important aspect of having the benefit closely administered. There again, that's a claim form you get from the website, from the doctorscouncil.org website. And you would just complete the claim form, attach a receipt from the licensed audiologist or an ENT, and send in the claim, and you'll get reimbursed for the hearing aids for a maximum of $3,000, which is $1,500 per ear every 2 years. Just moving on to the legal service benefit. Now, the legal service benefit, there are two benefits. The first one we talk about is the in-state, we call in-state, New York State residents. So there again, you can access through the fund. You would need a certification form first before you can contact the law firm. But once you do, you'll be sent, usually by email, a certification form which entitles you to the legal services that are provided by the firm Pryor Cashman. Now, so there are no, if you want to utilize the benefit under in-state, it's prior cash who the plan retains to provide these legal services to you at discounted rates. And one of them is a 2-hour free consultation each year. So that is something that you can take advantage of if you have a matter that you just need to discuss and which way you need to go. You would just contact the fund office preferably by email, and request in-state legal services certification, and it will be sent to you, and there will be a number and name and number on that form for you to contact at the law firm. There are other services that are provided at greatly reduced rates, such as home real estate transactions for the purchase or refinance of a home, or 2-family residence. So it is usually far below than what the market rate is out there. So
So, Dan, before you move on, Richard Bethel is on the line. Richard, if you could unmute yourself, is there anything you'd like to add for the legal service benefit? Richard Bethel is with our firm Prior Cashman.
Thank you, Kevin. I think Dan's done a pretty able job of describing it. I think what I want to emphasize is that we cover pretty much anything, any legal issue under New York law arising in New York State, with the exception under the plan of anything arising out of your employment. Issues related to your employment, you would, as always, raise with Doctors' Council contract administrators, and they make the determination about how to proceed. They'll work with us, but that would not be covered under the legal services plan, would not be paid for by you at all. But the array of services we do provide under legal services plan, as Dan said, is broad. Certainly the most commonly used benefits are the real estate benefit, the trust and estates, that is will preparation or estate administration benefits. But we really run the gamut, and we do see almost any imaginable issue coming from Doctors' Council members. Thank you.
Yeah, thanks, Richard. Just 1 or 2 things I would add to that is that in addition to what was touched upon, we also have at greatly reduced rates, if a doctor finds his or her license in a position that can also be utilized for that. And we're going to have a presentation on Tuesday, March 30th on particular legal topics that may be of interest to folks. So that's coming down the road. So jumping back into this. That brings us to.
all right, so thanks, Richard. The maternity adoption benefit, that is probably the most simplistic benefit that you can take advantage of. Should be fortunate to have a child or adopt a child. It simply requires a copy of the birth certificate or the adoption certificate, and attaching that copy to what we call a maternity adoption claim form, which again can be either emailed or accessed to the website. And you send it in to the fund office for processing, and you are paid a $2,000 check. So it's again, it's probably the most simplistic benefit you can take advantage of, should you be so fortunate. And any questions about that, please let me know. It's again, it's almost like found money. You don't have to attach any statements from a hospital or anything. It's just a copy of the birth certificate or adoption certificate. So, moving over to the optical benefits. Now, here again, you have an option to go either in or out of network. The optical benefit will pay or reimburse you up to $300 per individual member, family member each year, plan year, for the purchase of prescription glasses, contact lenses, eye exam. The benefit is where you can go to, say, a LensCrafters or Costco or what have you, get your eye exam, purchase your products, prescription glass products and attach it to an optical benefit claim form. And you would then get reimbursed for the maximum of $300. The other option is if you wanted to go, say, in network, we have a vendor we use called CPS Optical, And with that, the caveat is you must contact the fund office to obtain a CPS Optical voucher. And the voucher is good for an eye exam and the purchase of a pair of glasses or a year's worth of contact lenses at one of the participating providers through CPS Optical. CPS Optical, they have a website where you can actually search for a provider, cpsoptical.com, or we can send you a list. But it's important to recognize two things. One is you need a voucher before you go to select your list of those providers through CPS Optical. And you can either use the out-of-pocket expense of optical benefits, pay out of network, or you use the CPS Optical voucher in the plan year. So you can't do both. So it's one or the other. Your individual family members can choose to go to a participating provider, and you can choose to go out of network. That's fine. But individually, it's one or the other during the plan year. The next benefit, the physical exam benefit, you're entitled to. Your spouse, domestic partner, are entitled to a annual physical exam through our provider, which is Executive Medical, also known as affiliated physicians. And their location is now on Greenwich Street. It used to be up in Midtown, now it's on Greenwich Street. And there again, you're required to present a certification or verification from the fund office that you can, that you're entitled to a physical exam through Executive Medical. So you would, again, just email or phone call, and we would email you a certification form, which you would then bring with you to your visit. So you would schedule your examination directly with Executive Medical, not with the fund office, and you're entitled to a comprehensive physical exam each year. And some of it is you can have it sent, the results, to your primary physician or yourself. But again, you're entitled to it once a year yourself or your spouse or domestic partner. The podiatry benefit there's actually a litany of services under the podiatry benefit. But we also, and it's important to mention, we coordinate benefits, any benefits that overlap with your major medical plan. And in this case, sometimes it's podiatry. We are the secondary plan. So you would present your claims to your primary physician, primary insurance, and then you would submit it to us. So we have a podiatry benefit that includes, the most popular one probably is orthotics. And we pay up to $450 for a pair of orthotics each year. So it is available to members, spouse, but not to children. We've gotten some cases where we have some requests for children, but it's not available, unfortunately, to dependent children. So there are some other benefits that are in the SPD, but we just wanted to highlight what's available, the most popular ones I would suggest. But if you look at just the benefits that we've touched upon, the savings to a member in a family can account to $2,600 a year. And that was actually done, a study was actually done on what the estimate would be, and it is about $2,600 a year per family. So that's no small piece of change.
Yeah, and just to flush that out a little bit, if you take the $1,000 tax-free back and the free dental and the different benefits, put it together and comparing it to employees that have to pay for their dental and don't have these benefits, that $2,650 is what we came up when we analyzed it a couple of years ago. So Dan's exactly right. So please be aware of your benefits and utilize them.
And thank you, Kevin. So the other benefits that are listed, we have a blood benefit, there's a disability benefit. The life insurance benefit, it's a group of life, like a term life plan. There's mammography benefit, and there's private duty nursing and psychiatric. So these are in addition, so you have about a dozen supplemental benefits that you can take advantage of through the Doctors Council Welfare Fund, and again at no cost to you. There are additional benefits through SEIU. If you go to the website, the Doctors Council website, and you click on a link for members, member services, there's a little drop-down menu, and then you'll see additional benefits through. If you click on that, it's through Union Plus, which has as you as members have different benefits are available, like discounts on credit cards, mortgages, different family services, sometimes fuel purchases, you eat your home, different things like that. There again, that you can save additional money just by being a union member.
Can I ask a question?
If you could just wait to the end, Doctor, and send it through the chat. Thank you very much.
Okay.
So now we're going to come to some questions that members were good enough to email in advance. Dan?
So these, we appreciate all the questions that come in, and so let me try to address them one by one. The plan year, and this comes up a lot. What is the plan year for the welfare fund? Well, the plan year for the welfare fund is July 1 to June 30th. So that means expenses that you've incurred during that period of time, such as if you have a healthcare cost reimbursement claim and your expenses that you've incurred, you want to submit for those out-of-pocket expenses, it's tied to the date that those services were incurred. So for example, we are in the July 2020 through June 30, 2021 plan year right now. So if you had expenses you've incurred between July 20 and to date, then that's where those benefits would be eligible for reimbursement for this plan year. As far as getting claim forms, there's two links, info@doctorscouncil.org or the benefits@doctorscouncil.org. You can get claim forms and get more information from those two links. Phone numbers, the office number, although many of us are working remotely for the majority of the time, the phone messages are retrieved at the office number 212-532-7690. But you can also text me at and call me at 347-468-2314 or 201-681-7056, and I try to respond as soon as possible. The any access to the claim forms or the website, doctorscouncil.org, and then you go to the tab that says member services and click on the benefit welfare funds. Summary plan description. That is details all the benefits in more detail in addition to just benefits. What's covered under the plan, who's eligible. So it's important to review that SPD. And if you have questions about that, please let us know. We'll talk about that in a minute. Now, as far as the supplemental coverage, so your employer provides major medical insurance, and some of that major medical insurance could include, and sometimes does, optical benefits. So as I mentioned earlier, we do coordinate our plan with your primary insurance plans. So what you would do in that case is you would submit say, your optical benefit or expense under your major medical insurance plan. Once your major medical insurance plan pays or doesn't pay, they'll send you a statement called an explanation of benefits, or EOB. You would then take that EOB copy and send it to the welfare fund by email, preferably with an optical claim form attached. And we would coordinate the benefit between what your major medical insurance paid, or your primary insurance paid, or did not pay. And you would be reimbursed for the maximum allowed under that plan, that benefit. So the other question, I have used in the past a listed provider. How does it work? Doctors Council calls reimbursement. The way it works is if you used an optical benefit provider, participating provider, which would be through CPS Optical, you would then contact, right now there's the way that we're doing it is you contact me at the office by email and request an explanation of benefits from our office showing that you've exhausted your optical benefit by using the CPS Optical, but you have other optical expenses that are outside that. And that's what you would attach, and how it relates to the healthcare cost reimbursement. You would attach a copy of that explanation of benefits to the healthcare cost reimbursement claim form and submit that. And that would show what we paid. You have your additional receipts for expenses. So it would show that you've already exhausted your optical benefit under the welfare fund, and therefore you're entitled to the additional expense you've incurred under the optical. So I think that kind of addresses that question there. The how exactly do you submit glasses bill for reimbursement? Just to reiterate, if you go to, say, a Costco or LensCrafters or some out-of-network provider, you would get your receipt for your optical services, your glasses, eye exam, and submit a copy of those receipts to attach to an optical claim form and submit it to the address on the claim form, which is the fund office. Preferable method, as I mentioned, in most cases, is email. And they could be emailed directly to me or through the doctorscouncil.org. Now, the optical benefit plan years, January to December, I think we addressed that. It's July to June. So the plan year for the welfare fund is July to June, but keep in mind of the timelines, you must submit the claims within a year from the dates of service. Moving on to mental health. Let's see. Okay. My daughter, okay, so there again, this is another example of coordination of benefit with your primary health plan. In this case, the United Health only pays a portion, and then we would pick up the maximum allowable amount under our psychiatric benefit, which is 50% of the cost for a maximum of $75 per visit. So 50% of the cost per visit up to $75 per visit of what's not covered under by a healthcare provider. So you would, again, we would require the explanation of benefits that was submitted to your primary insurance carrier, along with the receipts for the services from your provider, and then we would coordinate the benefit. There is no preference in the collection of bills to submit every year. You can submit it as you receive the expenses or incur the expenses, or you can wait to the end of the year to submit them. There is no real rule. It was recommended that you submit it at the end of the plan year, but it's just a recommendation, and it's not required. Just keep in mind, again, the timelines to submit the claim. With just jumping back for the healthcare cost reimbursement, where it's a little different, the healthcare cost reimbursement plan benefit is, the plan year is still July to June, but because it sometimes takes members a period of time to put together all the receipts and so on, you have until the end of the following plan year to submit those claims and get them submitted to administrative services. So in other words, we'll be coming to June 30th, 2021. So any expenses that you've incurred between July of 20 and June of 21, you have until June 30th of 2022 to get them submitted to administrative services for processing. So you get a little like extra time. Orthotics, how to request and submit. There's a podiatry claim form available on the website, or we can email it to you. And then you submit it back to the fund office for processing. Disability, there is no family leave under the welfare fund. We do have a disability benefit, which allows you to get a payment of maximum of $2,000 per month, provided you are out more than 10 weeks. You don't get paid for those 10 weeks while you're out. And you must be totally unable to perform the duties of your profession. And there are rules with that, the way it must be filed. Disability benefits must be filed. Claims must be filed within 3 weeks of the onset of the disability to make sure it's submitted timely. And then be by both your attending physician and yourself. It's claim forms, but I can more detail about that I can explain another time. Relation with doctors, council benefits, and FSA. This actually comes up. FSA, and there is no coordination of benefit between the healthcare cost reimbursement and the FSA. You can use expenses, you pay from your FSA to purchase a number of things or pay the number of expenses, but it's the end expense, not the FSA, that counts. So in other words, if you use your FSA to pay for optical benefits, then it's an optical benefit claim, and it's just dollar for dollar, whatever was submitted. So there is no real coordination of benefit.
And Dan, folks do not need an actual physical card to show the provider.
Oh, yes, sorry. So that, yeah, there is no card. That comes up sometimes. Unfortunately, we don't issue cards, but if there's any question about eligibility, and it usually comes up with dental, contact the fund office, and I'll be happy to explain it. The coordination of other benefits, I think I kind of went over that. Healthcare cost reimbursement. Yeah, so if you have existing benefits under the welfare fund that you've already been reimbursed for, say optical. So suppose you spent $500, we sent you a check for $3. That remaining $200 can be submitted under the healthcare cost reimbursement. And all you would need to do is when you get that check, when you have a check from the welfare fund, there's that explanation of benefits is attached to that check. And you use a copy of that and attach it to the healthcare cost reimbursement, send it to administrative services. Okay, so be a concern, new benefit if a member dies, the benefits be expanding, covering surviving. Yes, that would be through self-pay COBRA. So it's important to, as unfortunate the circumstance may be, to contact the fund office as soon as possible to let us know of any change in circumstance such as that, because for the first 12 months, a surviving spouse is eligible for, under COBRA, the continuation of the COBRA benefits at no cost. So for 1 year out of the 36 months, there's no premium to the surviving spouse.
All right, so Dan, before we go on to the summary plan description, the SPD document, we have some real-time questions. So let's see if we can take a few moments to try to answer those, and then we'll circle back to whatever we can't get to. So what's the time limit for the maternity benefit?
So it is a year from the date of service, in this case, date of delivery. You need to submit that copy of your the birth certificate and the claim form. The quickest way to do it is through email, and as is most claims now, that's the way to do it.
How can we get connected to the legal services if we have some questions?
You'd need to contact me at the fund office and request a certification for in-state legal services certification form, and then I would send it to you, and then I also notify the law firm to expect that you will be calling to arrange a discussion with the attorney.
Is there payments or any type of orthotics, even those that my primary care insurance may deny?
Yes, goes back to the coordination of benefit. If your primary insurance does not cover orthotics or a small portion of it, we cover up to $450 for a pair of orthotics for a member and spouse. You just submit a copy of your explanation of benefits from your primary carrier showing that it was not covered or only a portion was covered, and then you'll get a check.
If you use the CPS optical, is there still a $300 limit per family member?
Technically, it's not, but the way it works is when you go to a particular provider, they will show you, one is you're entitled to a free eye exam. But if you say you want a pair of glasses, they'll show you which rack or which case our plan covers at no cost to you. So if they show you a case or a rack, it's okay, you can select any frame from this case or this rack. You can get these type of lenses, progressives, what have you, at no cost. The $300 really doesn't come into play. If you select something outside of what's offered under the plan, then there would be a co-payment, if you will. If you select some type of frame or lens, that's not covered.
How do we find the additional SEIU benefits? I think I can answer that one. If folks look at the 4-page summary booklet that we've emailed out a couple of times, if you look on the last page towards the bottom, you'll see a website to go to as well as a phone number to call. We encourage you to visit that website or to call that number because benefits through there do change from time to time. It's also on our website, but it's in the 4-page booklet. Can you go to an ophthalmologist for eye checkup and submit to ASO for the reimbursement from the $1,000?
Yes and no. First steps is you can go to the ophthalmologist, you would submit it to your primary health insurance plan first, then submit it as an optical claim to the welfare fund, because we do pay for, it's an optical expense. So whatever wasn't covered by your primary insurance carrier, we would cover up to the maximum of the optical expense. After that, then suppose it's exhausts the optical expense, then you would then take that check what we'd send you and then attach the explanation of benefits and submit it under the healthcare cost reimbursement for the towards the $1,000.
Does the life insurance require a physical exam, and do pre-existing conditions matter?
No.
Okay, that answers that. What exactly is the disability? Does one have to apply before?
So the disability, if you are anticipating that you're going to be out, say, for whatever type of surgery or whatever the case may be, it's important to, if not yourself, you're unable to have a family member contact the fund office to get the disability, initial disability claim forms. They are not available on the website, so that's why it's important to contact the fund office. So the disability claim benefit, the way it works is you must be out 10 weeks or more, at least 10 weeks, and be unable to perform the duties of your profession. And the disability claim forms, one from yourself, one from the attending physician, is reviewed by the board, and they will determine whether you're eligible for the disability. And it's important to get, as I said, to get them in 3 weeks, within 3 weeks of the onset of disability. So if it starts today, you have 3 weeks from today to get that claim form, those claim forms in.
Gotcha. Can we use the healthcare cost reimbursement if I have medical insurance through my husband?
Yes, your husband's spouse member is eligible, and you can submit those copies of your pay stubs or receipts that show those premiums paid. And yes, you can submit them.
Does the psychiatric benefit cover family members?
Yes, it's extended to member, spouse, and eligible dependent children.
How long can the disability benefit last?
It's a maximum of 36 months. The payments are issued monthly, but it is a maximum of 36 months.
Is there any way that the maternity benefit can be extended beyond 1 year?
Uh, it's a suggestion that any changes to the benefits are submitted to the board. Unlikely that we'll change that benefit. But
You take a look
we're
at it.
taking it under advisement.
How does the life insurance work?
Well, there's a maximum of $50,000. You're automatically covered as part of an eligible member covered as part of the benefit package, so part of the welfare fund. It's a benefit. So, but an important thing to point out here is make sure that you have named a beneficiary to the life insurance. And that is a section on the enrollment form that requests names of your beneficiaries. If you don't, you're not sure whether you've named beneficiaries, please let me know, because that's an important thing to have.
Does disability apply to work that is outside New York City employment, private practice? What I've surmised the doctor's asking is, we have a member who works for the city, but let's say that they get disabled in a job that's not covered by us, that they get disabled in their second job.
Well, if you're disabled, you're disabled. So it's if you're unable to perform the duties of your profession as a New York City under New York City employment, that's what matters.
Submitting an optical plan to major medical plan, is that new, or is that part of the coordination that usually occurs?
Submitting an optical plan, I'm not sure what that means. I mean, unless you fill in an optical claim form, you would submit it only if your major medical plan covers optical. So if your major medical insurance does cover optical, and some of them do, then you would submit it to your major medical plan first, and then submit it to the welfare fund to coordinate the benefit.
Thanks, doctors, for those questions so far. We're now going to proceed to the summary plan documents. And make it legible for everybody. And we're going to, can everybody see that? Yeah, so,
Okay.
is it showing the SPD?
Yes,
Okay,
Oh,
thank you. So we're going to touch upon those benefits that have not already been touched upon. So you just bear with us while we get to family medical leave. Did you touch upon that then?
Yeah, there is no family medical leave. That's something to be addressed to your employer or with your employer.
Dependent coverage.
Dependent covers children up to age 19, and then up to age 26, provided you submit we call a special enrollment form, which I believe is available on our website. So any child that's turned 26 or will turn 19, you should submit a special enrollment form for that child, so we can add that to your file and extend the benefits under the welfare fund through the child's age of 26.
Coordination of benefits, I think you touched upon a couple of times.
Yeah, yeah.
Claim filing procedure. How do I file a claim?
The best way, especially these days, to file this claim is through email. You could scan the document. You don't have to list your full social security number. You could list the last four. If you're not even comfortable with that, just leave it out. Most cases, I'll be able to find you and email it to the doctor's council, and we'll process the claims off of that.
And folks can email to either info@doctorscouncil.org or benefits@doctorscouncil.org.
I sometimes, when I speak to members directly, I have them send it to my direct email, but that's fine. So
It's easier to remember info@doctorscouncil.org or benefits@doctorscouncil.
yeah, my name is very long.
Okay. Blood benefit. If you need blood, how's it work?
So if you're in a hospital and an acute care facility and you need blood, you're entitled to up to 10 units in one period of your hospitalization. So, and that's coordinated with your primary health insurance again. And so there again, you'd have to submit an explanation of benefits from your carrier along with the receipt that's showing the expense for the blood.
Cobra, how does Cobra work for the welfare fund?
So Cobra, and this is important to remember too, if you are no longer employed or you're going to no longer be employed in the capacity, reducing your hours, whatever the case may be, where you're no longer going to be covered under the welfare fund, or status has changed, contact the welfare fund, contact my office and let us know. The Cobra coverage is good for 36 months. I'm sorry, 18 months. And it's self-pay. So depending on your rate, if it's individual or family, the rates vary. But the maximum coverage is 18 months from the qualifying event date. And that qualifying event date is usually the last day of your employment.
Dental, we already covered. Moving on to the next benefit. Dental goes on for a while.
Yeah, fee schedule, disability.
Disability, we covered, right?
Right.
Healthcare cost reimbursement, $1,000 back for the full-time, we covered that. Hearing aid benefit,
Hearing aid, we did touch on.
covered. Legal service benefit, we covered. Everybody see here for the legal service benefit, we're gonna cover this more in a presentation next month. But there's fixed costs at very reasonable prices for real estate transaction, matrimonial. Again, the 2 hours free and 50 hours at a reduced rate of $200 an hour. State license proceedings for your license. Estate planning and state administration. It's a very thorough legal plan. As for out-of-state reimbursement,
For those members who are not New York State residents, we have a second tier, if you will, of legal service benefit. It is limited to 2 types of services, one being the preparation of a will, codicil to a will, estate planning, or a real estate closing. So in this case, you would hire your own attorney. Say you live in New Jersey and you bought a house and you paid your attorney $1,000 for your real estate closing. So you would get a legal, out-of-state legal service claim form that's available on the website, or I can send it to you. And there's a section at the bottom of that form for your attorney to complete. You would attach either a closing statement or some statement letter from the attorney, which shows the address of the house purchase and the dollar amount that you paid, and you would get reimbursed for a maximum of $600 in the year.
life insurance benefit.
So this is, I would discuss the life insurance benefit as part of the benefit package, and you can see that it is a sliding scale depending on your age. So up to age 65, the maximum is $50,000. And then as you age, the benefit decreases until age 85. Again, it's important to beneficiaries. Please let's make sure that you have named your beneficiaries.
The mammography benefit,
Mammography benefit is coordinated again with your primary insurance plan. Most primary insurance plans cover mammography benefits. Our plan, you would then, same thing, you submit to your primary insurance plan first, get your explanation of benefits, whatever dollar value was left, we pay for a maximum of $200.
okay, that brings us to the next benefit. Maternity adoption, I think you covered.
Right.
Optical
Optical
benefit, you covered.
Physical
Physical
exam.
exam.
So there is the, we touched upon it earlier. This is, you're entitled to your annual physical exam, yourself and your spouse. It does not extend to children, but it's based on the calendar date or anniversary date of your last exam. So if you had an exam today, then you wouldn't be eligible for another exam until a year from today. So that works a little bit differently than the other benefits a year from the date of service. Their address is 225 Granite Street, Suite 520, and you're entitled to a comprehensive exam. The caveat here, as I mentioned earlier, is you must be pre-certified before you schedule your appointment. So you need to contact the fund office before you schedule your appointment. Sometimes a member will contact them in advance and they won't be able to help you until they see that certification form. So. Dietary benefit we did touch on earlier. With there's a litany of services that are covered. Most popular being the orthotics, but again, we do coordinate with your primary insurance plan. You can see the different schedule of allowances for the different procedures that are done. But in most cases, your insurance will cover these. But if they don't, or don't cover all of them, by all means, submit a detailed statement from your carrier and your major medical insurance carrier, EOB.
All right, Dan, please tell us a little bit about the private duty nursing benefit in hospital.
Okay, so private duty nursing is if you're confined to a hospital or an acute care facility and your physician recommends, writes a script for a private duty nurse, you are entitled to a maximum reimbursement of $900 per 24-hour period or per confinement for a maximum of $5,400 in a plan year. So it's for yourself or spouse or domestic partner, but it must be administered by a registered nurse or an LPN in order to be eligible for this benefit.
Psychiatric benefit out of hospital.
So the psychiatric benefit, again, is coordinated with the primary insurance carrier. And we have a separate claim form that, psychiatric claim form that you will need to have completed. There's a section for the provider to complete at the bottom of that form. And the maximum reimbursement is 50% of the cost, reasonable cost of the visit, but up to a maximum of $75 per visit. And it's per a member, spouse, and eligible dependent.
COBRA, I think we touched upon.
Yeah.
COBRA goes on for a long time.
Yeah, there's different, making sure that you file or notify the office of your change in status as soon as you're able.
Are there other important information, anything you want to bring up about claims or appeals or?
I do want to bring up one thing that's happening is make sure that when you complete any of the welfare fund claim forms, that you're using the correct claim form. We administer different plans. There's a retiree plan and there's a benefit plan. So you are on the welfare fund, make sure the forms that you select to use have the state welfare fund on it, or to give you an option of welfare or retiree. Make sure you select the correct form, because what happens is these forms, when they come, they're being scanned many times, most of the time it's being scanned, and they'll go into a wrong folder. They'll go into a folder for claim folders there where it doesn't belong. So it just delays the processing. If you're unsure which claim form, then please let me know.
So Dan, I think that pretty much covers the salient points of the summary plan description, the SPD document. Before we go back to any further questions, is there any other benefit you want to touch upon the SPD, or should we go to questions?
I think that it kind of sums it up. We can go with it.
All right, doctors, we're going to stop sharing screen. And we're going to go to the chat, and the questions are picked back up where we left off. If you give me a second. All right, can you talk about pharmacy benefits?
Okay, we don't have pharmacy benefits, but we do have a reimbursement for prescription drugs and prescription drug copays through the healthcare cost reimbursement, but there is no prescription drug benefit. Per se.
But that which a member pays for out of pocket can be reimbursed up to $1,000 to the healthcare cost reimbursement.
Correct.
Are benefits available to me after retirement and to my family members too?
Yes, if you meet certain criteria, you must be a participant in the NYSER's pension plan and submit what they call a health benefit application, which states you make a selection of which insurance you are selecting during retirement. So it does extend to member and spouse. It does not extend to dependent children after you retire.
Can you please share the recordings? Yes, we are recording this, and if it comes out okay, we plan to email it out to people who RSVP the same way we did it with the tax prep seminar. And please bear in mind, you already have the 4-page booklet and you have the SPD documents that we emailed out to you. How much coverage do we get for dental implants?
So the maximum lifetime is $5,000. That includes all the components of an implant. So we understand that some members think it's minimal, but a lot of plans do not even cover it at all. But that is the maximum lifetime. It's $5,000 for implants.
Gotcha. Can we have the legal benefit detail explanation in PDF format? Doctors, you already have that. If you look at the emails we sent out, it says, please click this link for the summary plan description. If you go into that and you go into legal benefit, you'll see the whole legal benefit explained in detail in the document. And again, we're also on March 30th, we're planning on having a forum on legal benefits as well. So you'll get another opportunity to drill down on that at that time as well. We always submit optical claims for glasses to Doctors Council directly. Yeah, that's good. Do psychiatric benefits cover family members?
Family members for active welfare fund, yes.
Is part-time doctor working over 20 hours get full-time benefits for all benefits?
Yes.
Yes, okay.
Retirement.
Can you talk about retirement?
Okay, so just, I guess, dovetailing back when we talked about retirement, the benefits are available to those members who are eligible retirees under the retiree welfare fund, and they meet that criteria of being a NYSERS participant and submitting a health benefit application. The benefits are basically the same as when you're active, with a few exceptions. You no longer have the group life insurance policy. You don't have a maternity adoption benefit, and you don't have a disability benefit. And in the cases of dependent children, the extension to dependent children no longer applies.
Which pension plan does it extend to for retirement? Or whatever, somebody's a question is asking, which pension plan do I have to be part of to get the retirement benefit?
NYSERS.
That's the New York City Employment Retirement System.
Correct, sorry.
And that's the question. So doctors, we have covered the 4-page booklet highlights, the questions that were submitted in advance, the questions that came up through this meeting, and then the summary plan description, endeavoring to touch upon every benefit. Of course, if you or your colleagues have any question outside of this meeting, please don't hesitate to pick up the phone or shoot us an email and give us a call. I'll be more than happy to talk to your colleagues about that. There's a question about going on the Union Plus website and finding our union listed. Probably should look under SEIU Local 10MD, but
It's listed as Service Employees International Union.
yeah, if you can't find it, then contact us tomorrow. We'll walk you through that. If there's no further questions, Dr. Proscia, is there anything else you'd like to add or say?
No, thank you very much. It's really good to see the interaction that was going on. I hope all your questions were answered. And please utilize the benefits. They're there for you and your families.
Yeah,
Thank
Doctor, I just want to amplify that. Thank you, Dr. Procha, that we endeavored to publicize these benefits. We've mailed them out, we've emailed them out a couple of times. And we've done this presentation. So please utilize your benefits. Tell your colleagues about this. And we hope that you found tonight's presentation informative. The feedback that we got from last month's tax prep seminar was extremely positive and encouraging, and a lot of people are using that benefit. And a preview of coming attractions, like as I said, on March 30th, we're going to have a drill down presentation on the legal benefits, as well as a little legal 101, in terms of different topics that might be of interest for people on legal matters. So thank you very much, doctors. We appreciate the time. It's always good to see you. We appreciate what you're doing. Enjoy your evening, and until we speak again, please keep safe and keep well. Best to you and your family.
Thank you.
Good night, everybody.
Thank you. Good night.